Hi, this is Terry Kuti of Deep Sea Foundation. Such an honor today to be here with these two gentlemen who are on either side of me. They are the two gentlemen who kicked me in the booty and said, Terry, you need to open a foundation. The gentleman to my right is our oldest son, Rich Kuti.
Hello.
The gentleman to my left is Dr. Minas Chrysopoulo of PRMA in San Antonio. Very happy to say that he did my successful DIEP flap. This morning, I'm going to let Dr. C do the interview, and I'm going to enjoy. Take it away.
Great to have you both here.
Great to be here.
Terry, I can't believe it's been a year already since the last time we got together at the ASPS. That
In
was
Orlando.
in Orlando. That was a great conference.
It was.
Spreading patient advocacy.
Yes.
Our first panel, and we're going to repeat that this year, so that's great.
Yeah.
So, Rich, great to meet you.
You as well.
I heard a lot about you.
I've heard a lot about you too. Glad we finally got to meet.
So, you're in a position that you can really help us out as surgeons and our whole team.
That's great.
So I really want to take this opportunity to pick your brain.
Yeah,
So
absolutely.
I think patients through the foundation will benefit, but also physicians. So you were the primary caregiver after your mom had her bilateral DIEP flap surgery.
That's right.
Right. So what were your expectations before she came home, before she traveled back, and before you started taking care of her? What were you expecting?
Yeah, to be honest, I wasn't entirely sure what to expect. I knew that it was a significant surgery, and I knew that she would need a lot of care. So that's kind of a vague thought to have in the back of your head, to understand that you're going to have to take care of somebody, and they've gone through something that's fairly traumatic. And I think from my perspective, understanding a little bit more about, maybe finer points about how I could help her. Here's the 2 or 3 things that you can do kind of before surgery, post-surgery, that will set her up for success. So in my mind, that was really kind of, it was a big, vague idea, but understanding kind of more the details I think would have been more of more benefit to me.
Did you have a conversation? All our patients go through pre-op, kind of a pre-op process, and we give instructions and everything, but let's be realistic. How do you really know what to expect when you've never been through anything like that? So it's just words, right? So do you remember anything of your mom, in terms of what she passed on to you? Hey, you're going to have to do these things. Do you remember any of that stuff, or is it all a blur?
Yeah, it was quite a blur, because it was, as you can imagine, a very busy time. I think it was, the biggest question in my mind really was, what were the limitations? Okay. And I think there's people that are more active, there's people that are less active, and my mom's always been a very active person. So really what I wanted to know is how I could kind of, I guess, temper those expectations about what she could and couldn't do, while also being able to support her.
Right.
So in my mind, it was basically, how do I make sure that she's getting enough activity to kind of fulfill that need to be active, but also kind of reining her in when she needs to be.
Oh yeah, she needs that sometimes.
She does,
I
yeah.
was going to say, that's kind of my persona there.
Yeah.
Now, on the flip side of that, I can imagine, if there's people that, are less active, how do you encourage them to be more active?
Yeah. I think you're hitting on a really big point for us. It's a big concern, because oftentimes we haven't met the caregiver. And that's
very true.
And that's especially the case in our practice, because we do so many of our patients are from out of town, out of state. So we can only go on what the patient tells us.
Right.
We love it when the caregiver is there to hear the pre-op stuff, and we do a lot of pre-ops over the phone.
Yes.
But all families have scheduling concerns, life, that have work and all the rest of it. So logistically, it's always tough. What you mentioned is a very big concern for us, the mobility aspect, because when your loved one comes home, you want to take care of them, right? So I'll get that, and you just put your feet up here on the sofa and watch telly, and but that's actually the worst thing you can do.
Right.
So absolutely, you don't want to come home from a bilateral DIEP flap and go horse riding.
Yeah.
Okay, but at the same time, we don't want you camped out on the sofa or in bed the whole day, because you have to move. Otherwise, you really risk complications like blood clots
Sure.
by not moving around enough. So there is a balance that you've got to strike. You don't want, if the patient's thirsty, if your loved one is thirsty, you don't want to say, "Oh, get up, get it yourself."
Right.
But at the same time, walking around multiple times a day, and then each day you walk more often, and every time you walk for longer. So you increase the frequency and the degree of the mobility. And then the other thing for us that's a concern is nutrition. So we tell patients ahead of time to optimize their protein intake. So diet is very, very important to prepare them for surgery, but often after surgery you don't feel like eating. So then you become actually malnourished, in essence, at the time when you need the most nutrition to heal.
Right.
And
so those steaks that he cooked, those
were
were
perfect.
good.
Were perfect. Yeah. That's exactly right. So that's another place where caregivers can really help out. So I think for me, as a surgeon, it's mobility and nutrition.
Yeah.
And obviously, as a caregiver, you've got to have a very close relationship, because I'm sure there were times, especially the first few days, where your mum needed a degree of help.
Yeah.
Showering, personal hygiene stuff, that kind of stuff. So patients need to be cognizant of that when they pick their caregiver.
Yeah.
Yes. Yes, and I have to say, the first week out of hospital, when Dad couldn't be there and he had to go back to work, that's when we chose a good friend, another female, and she helped me with my showering. You met her when I came from my post-op. So that worked out well for me. But also in terms of driving, this guy was my driver, because you took off work, thank you very much, and drove me to physical therapy the morning we got back from San Antonio. I do remember our events. We talk a lot about the right kind of bra to wear on the journey, and there he was in Kohl's. Do you remember that day?
Yeah, I do.
That's love.
Yes, that's love. Mom, don't worry about it. I can handle the bra section. And I said, Rich, can you bend over and get that one down there? Because that's the one I think I want. So simple stuff like that, when you're lacking the mobility or trying to get it back, those are helpful to me.
Yeah, good.
Fluffing my pillow at night, that was my favorite part. Either you or your brother would come check on me.
Yeah.
Tuck all my pillows in behind me. What do you need, Mom? Do you need water before you go to bed? Do you have your cell phone in case you need to call somebody? Because I was in
That's a good point.
Yep, I slept on the low sofa by myself, so no one would roll onto me, like your dad.
Yeah.
And I was kind of out there by myself, so you guys made sure that I had access to, if you need something, either ring the bell, call on the phone.
Yeah, and I think that, looking back, I think one of the other important things that if I would have had the knowledge then, that would have been very important to understand, would have been, if there's 3 things that Mom needs by her bedside, what are those 3 things? Is it aspirin, water, and whatever else that third thing is? But even little things like that, about certain situations. If she's in the shower, is it helpful to have an extra towel, or do we need to have a stool in there so she can sit and be comfortable? So all of those little items, checklist items, which at the end, you kind of figure it out as you go if you need to. But just kind of be having that knowledge, being prepared ahead of time, allows you to pivot and make changes and improvise when you need to, I think. So.
And I think with so many things to consider, it's easy to presume something is obvious, right? But when you've got so many things to plan, it's tough. I mean, having a drink next to you at all times, because hydration is very important.
Sure.
Right?
Yes.
So really, it's a very rare event, but the only time a patient really gets into trouble after they leave is because of dehydration. They don't drink enough, their blood pressure drops, they feel, So that's certainly one thing to have next to them at all time, and pain meds if they need them, and a bell is great.
Yeah.
A phone,
Right.
Yeah.
that's great. The shower and the stool in the shower,
Yeah.
very, very useful. All those are very good suggestions.
Yeah.
And I think one more point, I think, is the importance of delegating responsibilities. So if you're in the privileged situation where you can have more than one person take care of you, delegate tasks. So one person can be in charge of the groceries, the other person can be in charge of what have you, you know. So that way it doesn't just fall on one person.
Right, because caregivers can get tired,
Exhausted too, sure.
exhausted
Yeah.
and overwhelmed too. It
Yeah.
is a real,
Well, especially when they're balancing their own family lives, you know,
Yes.
kids, all the rest of it.
Yes.
So.
yep, because our wonderful daughter-in-law gave him up right after they got married.
Yeah.
Bless her heart.
Yeah.
So.
Yeah.
Thank you guys both so much for this valuable video. We know everybody's caregivers are different, but I hope that these hints help both the caregiver and the physician to listen to this and go, you know, what is it that we could talk about and consult that might help as the family moves forward with recovery and healing.
Thank you very much.
Thank you.
I had to do that. I give him a pat. Thanks, guys.
Welcome.
Thanks.